Reading from the conversation, 10 ways South Africa can step up care for its health workers. South Africa's health system has a long standing problem, a severe shortage of medical staff. The World Bank estimates that South Africa has only 0.9% medical doctors for every 1,000 people, compared with the global average of 1.6. I'm joined by one of the authors of this particular piece, Kemalan Governor, Research Director at the Health Economics and HIV and AIDS Research Division, University of KwaZulu-Natal. Good morning, sir. Welcome to the program.
Good morning, sir. Well, thank you for inviting me to your program.
All right. The importance of looking after the health of health workers during COVID-19 can't be overemphasized.
Yes, it can't. And to put this into context, as you've pointed out in your introduction, we have going into the COVID-19 pandemic, we've had a shortage of healthcare workers in South Africa, a historical shortage of healthcare workers, and COVID-19 has exacerbated those problems. And what we argue in this piece that we put together is to say that one needs a strategy, a coherent strategy to deal with the plight of healthcare workers. And we've outlined some basic elements of that strategy, and we are saying that one needs to tackle all these elements in the strategy to see the plight of healthcare workers addressed and to reduce the levels of risk for COVID-19 infection amongst healthcare workers.
I see that in the list of the strategies that you've put together, one prioritizing screening and testing for healthcare workers. To what level is that happening in our facilities? Are they regularly tested, or is it just been something that's overlooked?
It's a good question. I mean, recall that we have a backlog in testing, COVID-19 testing, and there are kind of inconsistencies in waiting time for testing. In some facilities, the turnaround times are quicker, within 48 hours, but in other facilities, especially in rural areas, you could think that the turnaround time is a couple of days. And when you have delayed turnaround times on testing, it's not effective in controlling infections. You need to have sharp turnaround times to inform healthcare workers in order to practice the appropriate mitigating procedures.
And then there's the question around PPE and delivery to hospitals, particularly in rural areas. We've been involved in that, sending out some supplies in the early days of COVID-19 to doctors who needed them. But it seems that there's still this need or the inadequate supply to medical professionals.
Yes, Azar, I think you're correct again, and that's been one of the major challenges with healthcare workers is PPEs, and there's two issues related to it. The one is the shortage of PPEs, and that's partly related to the global shortage of access to PPEs and the supply chain management issues. And healthcare workers are always indicating that there isn't adequate supplies of this. However, the related issue is the training. Healthcare workers require more training on the proper use of PPEs. And it seems that in health facilities, we need regular training on the use of PPEs, especially if you're thinking about the full body covering equipment and how to use it, how to take it off, and how to disinfect in areas where you're putting them on and putting on personal protective equipment and taking it off. So there is a challenge in facilities regarding access and usage.
And so there's a number of these challenges that health professionals are facing, right? I mean, you've put together, I think, 10 ways that South Africa can step up to its healthcare workers. Where's this news landing? I mean, is it reaching the ears of those in authority in the health departments, the ministry? And do you see any practical changes coming in order to make the lives of healthcare workers safer?
Again, that's a insightful question, and we hope that the health ministry is paying attention to these issues. the point of writing this piece was to indicate that you can't focus on any one issue. Each issue is critical in the strategy. So the focus has been on personal protective equipment, and we think that's really important. However, one has to consider issues like psychosocial support services for healthcare workers, looking at transport issues, given now that we know that the public transport system can be a risk issue for healthcare workers coming to work. Proper management and staff communication and risk compensation for healthcare workers. So we think as part of a coherent strategy, one needs to look at all these elements, these key elements, and then to have an implementation mechanism. The other issue is really important is that at a district level and at a local level, at the health facility level, it's important to have a committee and an implementation body that pays attention to all these issues. And there is a kind of a communication between healthcare workers and management in hospitals regarding these issues. That's really important at this point in the epidemic.
Kemal and Governor, we're going to have to leave it there, unfortunately, due to the running on to 10 o'clock, the time for the news bulletin. But thank you so much for your time and sharing that valuable information with us.
Thank you, sir. Thank you very much.
Yes, that's